minutes because Heinola is taking the other 7.5 minutes from
You
this.
have these 15 minutes.
Oh, thank you, but this is generous. So I'm Heini Parkkunen, and currently I'm Executive Director of the Baltic Region Healthy Cities Association, which is a WHO collaborating center in the Baltic Sea region. And I have been doing that job since February, so that is not a very old career for me. And I still have my other leg staying in the city of Turku as a special advisor and healthy city coordinator. And I have been fortunate to be involved in Turku in this development of active living concept in the city since the middle 1990s. And I have not been involved in the latest development, so if you have questions about that, so I have to refer those to my colleagues who are not able to come here and send me as a special agent. Those of you who don't know, we are in the heart of the Baltic Sea region. We have about 176,000 inhabitants. We are the oldest city in Finland, and we have this strong development on physical activity. We have our Paavo Nurmi, the athletes, but also in this physical activity field. And Healthy Cities has been a strong development throughout the whole history of the Healthy Cities since the late 87. And greetings from other people in Turku, who, especially those of you who know Arto Sinkkonen and Minna Lainio, they send their greetings to the colleagues here. I will only highlight a few things which I regard, or we regard, in Turku as successes, the key elements for success in developing this active living, active citizen development. A lot of these things have been said already today, but as you see, this development started in the 90s in Turku, and I think Turku was among the first ones in Finland to think about these developments at the city level. And the wake-up call was a national program describing the costs and benefits of physical activity. And it was the previous economical recess period in Finland, when people had to think about that. How do we survive? How do sports survive in the city? And find out the reasons, and that was the starting point to collect information and present it to the decision makers, politicians, high-level mayors in the city, and also from the beginning thinking quite wide and in a strategic perspective. And you see from those years that a project, Turku on the Move, was established in 1994, and it was a 7-year project to establish these things in city of Turku. Not 18 months, not 3 years, but 7 years. And all the time thinking that how do we maintain these developments during these 7 years. And I think it was very good to have this kind of strong strategic thinking and long-term thinking from the very beginning. And also these, not only thinking of services for people, but also what has been described by others here, the communication, how do we counsel the sedentary people, and the facilities in environments need to be developed. One background was the green model. I don't go into detail that because Ilkka knows the model better than his own pockets, so you can go to him and ask more. And we can show also that people increase their physical activity if there is support. And this Motion 2000 or Turku on the Move project, one key point was that the sports department took the clear leadership on this process and project. But it took on board the other departments and other groups in the city. Healthcare, social welfare department, youth affairs, education, and creating this networking and also maintaining it. That's the hard work. So it doesn't just click like that yes, let's do a network. So it requires a lot of meetings, a lot of discussing what are the benefits for all these partners. Of course, you have done that all too, and know this as well as I do. And this networking was clearly one of these the successes in this process. It has been described in this book, what is available for you in this kind of network, or spider web, what departments, other partners are needed to support citizens of Turku to be more physically active. And how to activate people. This strategic approach. So you need the services for the sedentary people, different age group, with different health and or functional capacities, ethnic backgrounds, different people in a poor socio-economic situation. You need the facilities, easy to access, near home, mentioned already by others also. Communication is very important. The counseling. Where do you meet those sedentary people? They visit healthcare departments, so you bring the counseling there. They go to the supermarkets or malls, you bring the counseling there. And not waiting them to come to you. Also in this book you have the whole evening, time to read it. Some questions will become tomorrow morning. We retrospectively looked what we identified to be steps to success. And they are also described in this WHO document. Maybe in little bit different words, but the processes are more or less the same, and I think these can be identified in many processes. But our book is more colorful than the WHO. One of the recent developments is also chaining the services. So if you have a hip fracture, or you go to see the doctor with the diabetes, so we as professionals have to think about that. Yes, now this person has to go for healthcare services and maybe to some extra physical activity group there, but then after some time she or he has moves forward to sport department, organized things, then to the sports clubs, maybe then to the private services. So trying to think about, and again networking with the service providers, how do we link these services so that there aren't gaps for the people, and how do we inform those professionals that they can advise people to the services they really need. In the book there are described some cases how to reach the sedentary people, and I think one of the biggest challenges now, at least in Finland, is that there is a huge or growing gap between the socio-economic groups. Those who are in the poorest situation in socio-economically, they are, as Ilkka said, they are usually the inactive sedentary people, and those are the people we really need to look at also when promoting physical activity in the future. So, what's the success? Turku has been doing this more than 10 years. So, and of course, honestly speaking, within this time frame there are these uphills and downhills, successes and failures. In the political situation, in financing, many things happen. But when the background is strong, you have this strategic thinking, you have been discussed enough in the past, so it takes you quite along in the road. In the book where we were in 2006, it was showing a nice good trend of those people who were physically active, but suddenly 2006 came a drop down. There is no clear analysis why did this happen. The questionnaire is the same, the sample is, so there is something probably doing with this research methodology, but no other reason we have not identified. But we would like to get growing again in the future. Finally, some words about this WHO collaboration, jumping now out from the city of Turku. And maybe this is something we discuss more tomorrow, but there is this WHO official HEPA network, but within the Healthy Cities networks, there is also this sub-network of active living, which has had yearly meetings. Liverpool has been active member in this network, and we are around 10 cities, and with a quite flexible way of meeting and learning from each other. All of the cities are kind of forerunners in their countries and feel that they learn very much from each other. But there is also a wish to widen, and I think this is something that we can discuss with Tafisa how to develop collaboration in the future. Well, we have never survived the capital moving from Turku to Helsinki, so that we are now getting the better challenge. We are now the European capital of culture. Thank you.